be intelligent enough to protect ourselves and the planet from being infected. So basically, we are veterinarians, and hence certain points with regard to the foods of animal origin, because we usually consume the milk, the meat, the eggs, or whatsoever be the foods of animal origin, which forms an integral part of the human diet. And these foods of animal origin are intricably rich source of nutrients, and itself provides the source for the growth of the microbes. Basically, from the production chain, right from the growth in the farms, we are practicing intensive animal husbandry practices for rearing and mass production. So itself will be resulting in the approaches of production may result in the growth of the microbes and the sharing of the antimicrobial resistant or the drug resistant pathogens, which we'll be dealing in the couple of slides later. Then again, the trade and the import, then the processing establishment, where once the production has been started, we'll be using it for processing or production facilities in the slaughterhouse, the dairy plants, or those sectors of establishments. We are using all these animal origin foods for the consumer. And again, the competitive private sector, its introduction has got an integral part in this production chain, and thereby the outbreak of certain foodborne illnesses. While I'll be talking about this food safety issues, we have to have a concept from gate to plate, or from farm to fork, because right from the production till it reaches the consumers, it has to ensure its own safety, and that hygienic aspects has to be taken care. So an expert supervision is required, which is in total known as the food hygiene. And it doesn't mean that alone the foodborne pathogens should be absent. There should be absence of zoonotic diseases, which means those diseases which are transmissible between the humans and animals have to be nil. And so also with the chemicals and the residues or the drugs. So all these aspects, apart from the microbial contents or the biological contents, we have to have a nil quantum of the physical hazards or the chemical hazards or the microbiological hazards, which in toto means as a food hygiene practice. Apart from being in the veterinary sector, CSC has they have way back in 2000, early part of the 2010s, they have published a report on the presence of antibiotic residues in honey and chicken, which is alarming, because many a times we used to feed the infants with honey in the indigenous practices. So again, it will be creating a hazard to the public, general public. Then a couple of articles or general newspaper cuttings which has appeared in the global context, which highlights the presence of foodborne pathogens linked with the onions. They have reported around 860 cases, around 47 states of US, and hospitalizations were recorded. Then peaches, salmonella enteritis were reported. Then there was a massive lemon recall due to the potential listeria contamination. Again, these pathogens are foodborne pathogens of public health significance. And I have highlighted a statement put forward by a outbreak affected lady, who has told that the listeria contamination or the listeria products, contaminated products, has ruined her life itself. Because in 2019-20 period, the South Africa has reported one of the largest global listeria outbreak, and affected these humans in very bad shape. Then again, we used to consume the salads daily, and we know that a couple of items are being included in the salads, and almost all the items or the individual ingredients of the salads come from a variety of landscapes and variety of areas. So we are not certain what we are consuming, and it itself indicates the need for public health, say, or food safety aspects. So these foodborne illnesses, they go massively underreported, because many times we used to get a diarrhea or vomiting, and they cause significant human morbidity and mortality, of course. Whenever we will be getting an infection, a massive outbreak if happens, we will be getting, um, at some point of time there will be mortality rate or elevated mortality rates, or at some points there won't be such mortality rates, but the human morbidity or the infections we'll be getting is significant enough, and we can impose a dual burden both on animals as well as on humans, because it crosses both humans as well as on animals. It can be controlled at source when it is high cost effective, and it can pose a potential for global spread, as we have already dealt. And certain few examples, what I would like to explain is that this burden of foodborne diseases globally is substantial, because 1 in 10 people fall to ill due to the foodborne illnesses, and 33 million healthy lives are lost, life years are being lost due to this foodborne illnesses. A few of the outbreaks which we have seen in the global context is the 2011 German E. coli outbreak, because in many times we know that E. coli is a common commensal pathogen or flora, and it can turn itself to a pathogen, and they can share the antibiotic resistance, and thereby it could be a massive potential pathogen responsible for massive outbreaks. Then again, listeriosis, what I've already told, in 2019, 2017-18 period, there was a massive outbreak of listeriosis. Then Coxiella outbreak, again, a potential pathogen due to the unpasteurized consumption of unpasteurized milk can result in Coxiella outbreak. And it was the massive culling which was reported in the world after bovine spongiform encephalopathy. This Coxiella has reported massive culling in the sheep and goat. Then we know that the foodborne infections could be transmitted right from the contaminated foods. But apart from these contamination of or these food items, we can get the infection. There is every chance that we could get or pick up the infection from different sources, right? From the production chain, like from the food animals to the food produce, the food processing units, the ready to use foods, and the plant derived products, the manure we use for cultivation, the animal feed or the environment. All these will be resulting in a cycle of infection which could be transmitted through the environment which we live in. Then there are a few now pathogens which I'll just introduce to you. I'll not go in detail to all these pathogens. There is one known as Campylobacter, which is responsible for Guillain-Barré syndrome, which is a neuron damage, or what you say, peripheral neuropathy associated with this complication of Campylobacterosis, which is mainly seen as a result of consumption of contaminated poultry meat, or the bird or the chicken meat, mainly because the poultry and the pigs will be acting as the reservoirs for this particular pathogen. And we can also, there is every chance that we'll be getting this bacteria through the consumption of contaminated food or water, through the contact with the animals, and even from the person to person if the hygienic status is not well maintained. Then there is another bacteria known as Listeria. I have already told this particular pathogen, and there are a couple of new species this year also to this particular pathogen in the year 2021. Five more species have been added, and a variety of ecosystem sources can be acting as the source of this particular pathogen and result in sepsis, meningitis, and the most important the problem or the manifestation of this particular pathogen is the reproductive uh, disorders associated with the humans, mainly like abortions or premature birth or the stillbirth. Then it could be transmitted from the food products, be it meat products, be it milk products, or any contaminated vegetables, even we can get this infection. Then comes the zoonotic tuberculosis. We know that tuberculosis is a massive disease affecting the humans. Again, Mycobacterium bovis is an underreported pathogen of the world, and the tuberculosis, which could be zoonotic in nature, could be transmitted from the contamination of raw unpasteurized milk or the dairy products, or those products which are consumed from the raw milk. There are chances of bovine tuberculosis reports in India. Then again, certain foodborne viral infections, say like norovirus, rotavirus, hepatitis virus, mainly hepatitis A virus, hepatitis E virus, are the major viral pathogens. Coming to certain parasites, there are toxoplasmosis. Again, this particular pathogen could be transmitted by the contact with the cat feces, contaminated water and vegetable with the cat droppings of the cat feces, then raw or undercooked meat of large animals or the small animals could result in this infection with toxoplasmosis. And thanks to our cooking style, mainly in practiced in southern Indian part, that we use spices in ad libitum quantity, which and cooking practices which can destroy the infective stages of toxoplasmosis, whereas the raw salads, the eating of raw salads has resulted in an increased rate of toxoplasmosis in the northern part of the country. Even most of the people consume vegetables, and this could again be a causative agent for reproductive disorders also. Then comes cysticercosis, again a problem for this humans. You might have heard that the famous player Leander Pace has been infected with neurocysticercosis. Again, it's a foodborne zoonotic pathogens, wherein the pigs or the feces avoided from the pigs could act as a source of infection. Apart from cattle also, the infective stage could circulate in the food cycle and can infect the humans, and resulting in neurocysticercosis, which affect the brain and the central nervous system, apart from the systemic circulation also. Then again, there is another pathogen, echinococcosis. Again, it could result in uh, our food chain. Then trichinellosis. So these are the different pathogens which could be, there are chances that these pathogens could enter into our food chain, and a variety of biological contaminants have to be there. But I've already told in my first section of this talk that these pathogens could be controlled or prevented by the use of antibiotics. Way back in 1930s, sulfonamides were used for livestock farming practices, and mainly the antibiotics are commonly used in farm animals for therapeutic purpose, meaning they are for used for treating the sick animals. Those animals which are found sick were treated using these antibiotics. And apart from the therapeutic purposes, there was a purpose or indication known as metaphylaxis, wherein the treating of a herd of animals or a group of animals when at least one animal is sick, because there is every chance that the infection could be picked up by the colleague animal, and this particular fellow animals, in order to prevent the infection being transmitted or spreading, these antibiotics used to be applied in the farm practices known as metaphylaxis. Then comes the prophylaxis, in order to prevent the outbreak of the infections or contagious bacterial diseases. And we use factory farming practices or intensive farming procedures, wherein this antibiotics took off this reduce the negative effect on the high stocking densities. Also in poultry sectors, at certain point of time, we I mean this growth stimulation were practices were employed in massive farming practices in sub-therapeutic doses. And we can see that the global antibiotic consumption reports in livestock, that India is also one of an alarming situation, and we need to, what you say, judiciously use the antibiotics both in case of human settings as well as in farm animal practices. And this is again another burning issue, the antibiotic resistance, because the use of antibiotics both in farms as well as injudicious or indiscriminate use of antibiotics both in farms as well as in human settings could result in this antibiotic resistance, which is again responsible for uh, tolerance or the failure of action towards antibiotics in any other cases. So it is again considered to be a silent pandemic or a looming global menace. So how is this antibiotic resistance or antimicrobial resistance being spread? Uh, as I've already told that this intensive animal husbandry practices, be it any form like aquaculture or livestock or poultry, it starts from the antimicrobial usage in all these farm settings in order to control the infectious diseases which we have already dealt in the initial part. Uh, these antibiotic drug molecules or the drug resistant pathogens can enter into the water, manure, sewage, or sludge. Thereby it will be affecting the aquafarming. This aquafarming plus this sewage or the cultivation, the cultivars, the plants that we consume may get every chance that the humans will get infected. Apart from the nosocomial or the hospital acquired infection, we can also pick this infection from the hospitals as well. So in that particular chain, the antibiotic resistance or the residues of the antibiotics shed by these particular pathogens by the indiscriminate use can be a source of the antibiotic resistance throughout our ecosystem. And as I've already told, that resistant bacteria can cross the animal husbandry, the plant production, the aquaculture, and to the environment through the urine and feces of the animals and or through the humans, and can infect uh, both the chains, both humans as well as in animals, and it could contaminate the environment where we live in, which will be resulting in the the excretion of the residues, the antibiotic residues also. And it is now gaining the talk of the town from the last few decades, and we are now talking about the antimicrobial resistance. There are certain surveys conducted on antimicrobial resistance in animals. Way back in 2009, a decade old study was conducted in chicken, pig, and cattle, wherein they have found that alarming rates of antimicrobial resistance was reported in low as well as middle income countries, including India. The same time, the antimicrobial resistance studies were conducted in the foods, wherein most common foodborne pathogens like E. coli, Escherichia coli, Campylobacter, non-typhoidal Salmonella, Staphylococcus aureus, all these are considered to be the foodborne pathogens, and these foodborne pathogens were shown to exhibit antimicrobial resistance to the commonly used antibiotics, and the highest resistance was noticed in the fruit production among tetracyclines, sulfonamides, and penicillins, because these are the widely employed antibiotics commonly used in veterinary practices as well as in food chains. So these antibiotics are having the resistance apart from the increased resistance towards the ciprofloxacin, erythromycin, as well as the next generation or the new generation of cephalosporins. Again, the increased as I've already described in the previous slides, this is again an extrapolation of the previous study, a decade old study, where in Asian continent, they have conducted the study in Africa, Asia, and America, wherein they have seen that Asian continent, there was an increased or elevated reports of antimicrobial resistant foodborne pathogens, or these foodborne pathogens like E. coli, Salmonella, Campylobacter, and Staphylococcus has reported an increased drug resistance towards the commonly used antibiotics. And in order to combat such events, WHO has taken enormous efforts, and they have categorized the pathogens as well as the antimicrobials into three categories. Mainly the first one, the priority 1, 2, and 3, wherein this highlighted portions indicate the major foodborne pathogens, including Enterobacteriaceae, the carbapenem-resistant pathogens, then Staphylococcus aureus, Campylobacter, Salmonella, and Shigella. Almost all are foodborne pathogens. And again, WHO has categorized the antimicrobials for its use in medicine, both in veterinary as well as human medicine. Mainly, this has a rise from human medicine. And the CDC, again in 2019, has revised the AMR threat report, categorizing the pathogens into watch concerning urgent and serious category. The serious category includes some of the foodborne pathogens like Campylobacter, Shigella, Enterobacteriaceae, and Salmonella and MRSA as well. And WHO has recently classified the antibiotics um, as aware, that is access, watch, and reserve, which in the couple of discussion we will be discussing thoroughly. This aware classification of antibiotics also were proposed in order to combat such injudicious or indiscriminate use of antibiotics. So we are often seeing the dumping of waste, and we are not bothered with this dumping of the waste, but at the same time, this could be a source of uh, antibiotic resistant crisis because of all the unhygienic practices like pharmaceutical pollution crisis and the residues which are circulating within the ecosystem. We are more concerned about the AMU, or the antimicrobial usage in farms and farms or food animals, because this antimicrobial usage in animals could lead to the antibiotic resistance in humans and in animals. Apart from that one, it could result or reach the antibiotic resistance in the food processing plants, resulting in the residues in the food chain as well as the environmental residues in the manure and the groundwater, which could result in an evoked crisis of the future. In fact, antibiotic resistance is considered to be a silent pandemic which could kill majority of the people more than even the cancer what it can does now by the year 2050 if it goes like this uncontrolled. So that is the reason why we are promoting a one health practice wherein we have to join together, meaning the human experts, the veterinary experts, the environmentalists, all the categories, the teachers, the students, or the professionals, everyone has to join hands together to make a global health, what you say, a peaceful, our planet Earth, a peaceful or place to live in. So, with this one, I'd like to sum up this topic that we have to use the antibiotics very judiciously, and we have to avoid unnecessary use of antibiotics. Control or the use of, avoid the use of antibiotics very critical to humans, and use the right pharmaceuticals in a correct way, and we have to record and feedback this particular usage of antibiotics both in farms as well as in humans. So we have to practice good animal husbandry practices in a animal health setup. Prudent use of and efficient use of antibiotics is very useful, and it shall be practiced, and relevant vaccinations has to be promoted to control the disease, and effective biosecurity measures has to be taken care of. But uh, I have dealt with all the problems as well as the spread of antibiotic resistance in foodborne pathogens. The solutions and the control strategies will be dealt by Robin sir in detail. I'd like to acknowledge team which we are working together, and React also for having given me a time to interact with the students. We'll be interacting after the session by Robin sir. And sir will be dealing, I guess, on this control strategies of this problem. Thank you. Over to you, sir. Hello.
Hello?
Sir, sir, കേൾക്കുന്നുണ്ടോ sir?
Yeah, I can hear. Can I start?
Yes, sir, please, sir.
Is it okay?
Yeah, it's
Hello?
visible. It's visible.
Yeah, it's fine, no?
Yeah.
Thanks, Dr. Jess, for that wonderful presentation. He has covered almost everything, this, everything regarding AMR. Can you hear me? Is it clear? Hello?
Yes, sir, it's clear. It's clear, sir.
Yes, fine. Uh, he has covered all the aspects of AMR, including how it's a food safety problem also. So I'm only going to focus on what are the solutions. Yeah. If we know that we have a problem in hand, we are now looking at solutions. So how AMR in food animals, and what are the solutions for that? This has already been covered, that antimicrobial resistance is a global public health priority. You have, it's a big threat. It represents a bigger threat than climate change in short term. And 2019 AMR was one of the top 10 threats to global health. And now with the pandemic now most of the talk of AMR has been sidelined due to the standing pandemic of COVID-19. You look at AMR in India. If you look at students, if you understand is that food safety means food has to be safe from all the three types of hazards. The three types of hazards are chemical hazards, physical hazards, and biological hazards. So if you use antibiotics in food, that becomes a chemical hazard. And when these, due to the use of these chemicals, the bugs, they get resistance, then it becomes a microbiological hazard. So you look at India, what happens in our country in India, essentially, you look at it is that we are not so bothered about food safety. We hardly have any problem. You hardly see any recalls. Has anyone seen any recall of food being happening? There's so much food being produced. We never have heard of any news of any food being recalled due to any sort of hazard. So we don't have a system of food recall. Essentially, the problem in India is that we were a food deficient country for a long time, and just for the last few decades that we have started, we have enough food to feed our entire population. So that is a problem in a country. You look at it, you have 5 lakh deaths due to pneumonia. Almost 25% of all child deaths are due to pneumonia. All pneumonia patients need to be treated with antibiotics. You know, so if antibiotic stops working, you can imagine the number of deaths. So about 5 lakhs deaths annually due to pneumonia, and if there were no antibiotics effective, so you can imagine the number of deaths of neonates which are going to be happening in India. And this is the reason why we should use antibiotics very responsibly. India is estimated to face about 1 million deaths due to AMR by 2030, and majority of this is going to be the neonatal thing, due to lack of hygiene, and diarrheal deaths due to antimicrobial resistance, because antibiotics are not effective for controlling pneumonia and the neonatal cases. People are dying in ICUs. Most of this might have been already discussed with you by the medical professionals. Is that you look at PDR stands for pan drug resistant. You look at it. You look at PDR. PDR stands for pan drug resistant Klebsiella. Pan drug resistant means it is resistant to all of the available antibiotics. So the only available antibiotic in this case is fosfomycin, which is 25,000 per day for one patient. So patient is on 14 days in ICU. You can imagine how much the cost will be to him. So it's very important to see that antimicrobial agents, which are regarded as critical or highly important for use in human beings, should be minimized in food animals. Drivers for AMR in India. Sanitation. Dr. Jess has widely covered. Everyone is aware that how pathetic is the sanitation situation in our country. Poverty, malnutrition, very relevant things. Privatization of healthcare. Most of the healthcare, I don't know, Kerala, we have a good public health system, but most of the other states, you have to depend on private hospitals for healthcare. Thirdly is the use of antibiotics in food animals. We need to take care that antibiotics are not used as cheap production tools to counter poor hygiene in farms. Now you look at the patterns of antibiotic use. You look at 2/3 of the antibiotics are used in the animal production side, in animal agriculture, including aquaculture. So India accounts to 3% of the global consumption of antibiotics for animals. This thing, but the consumption of antimicrobials in food animals in India is expected to double by 2030, and it's expected to triple by 2035. AMR is a food safety problem. We should understand is that human and animals are often affected by very similar or the same pathogens. And so the same antibiotics are being used to treat this infection. So the AMR patterns, the antimicrobial resistance also remains very same, either in humans and in animals. And you should understand is that farm animals are exposed to considerable quantity of AMR genes, which can be transmitted to the humans through the food chain. So what is the solution? You need to have good farm management practices, better biosecurity. Biosecurity means is keeping your farm secure from pathogens. And then vaccination of farm animals to minimize disease. So if you, the crux of this, the solution to the problem is that you reduce the number of diseases in animals so that you reduce the use of antibiotics in animals. This is how this AMR bacteria, these are yellow in color. How it spreads from farm to table. Dr. Jess was mentioning from farm to fork. It's essentially the same concept. Is that when an antibiotic is used, the resistant bacteria will survive. They get into food. From the food, it can get in contaminate your kitchen. It comes to your surfaces. And then people get sick from eating the food, and from us again it goes back to the environment. In India, we have very huge problem essentially because we have very weak regulators in India. We have good regulations, we have good rules, but we hardly have any regulators to implement the rules. It's not that we don't have rules. Essentially, we have rules for everything, but hardly it's being implemented in our country. So, in absence of any stringently framed and implemented regulatory framework, the use of antimicrobials in livestock and food, especially for non-therapeutic purposes like growth promoters, I think so. Dr. Jess has already covered the types of use on animals. It is for therapeutic, means for treatment. Metaphyletic means to prevent the animal from falling sick. Growth promoter means to increase the growth in animals. These are three uses of antibiotics in animals. Burden of AMR in livestock and food animals is it is unmeasured. It is an unmeasured burden. This word I have taken from the National Action Plan in India is that aside from small and sporadic studies, we don't know how far this is a problem in India. First of all, you look at what Dr. Jess was saying, presenting data. How many foodborne infections in US, Germany? We don't have the number of foodborne outbreaks in India documented properly. So AMR is going to be an unmeasured burden in our country. Yeah, then this is a very important industrial food animal production. The 20th century saw something like an industrial food animal production. Production relies heavily on inputs like formulated food, pharmaceuticals, synthetic hormones. All this implicates in the presence of environment, of occupational and food hazard. This model has been increasingly globalized with multinational corporations expanding operations. I'll show you the picture. This is how an intensive food animal farm looks like. This is a broiler farm, intensive broiler farm, an intensive layer farm. This is an intensive cattle farm. You look at a cattle farm. These are closed. These are known as tabelas. Close to cities, you have large farms where from these tabelas, milk is being supplied to the cities. So you look at the hygienic practices over here. When you don't have hygiene, you need to have a strong use of antibiotics to prevent the growth of to prevent animal from falling sick. Essentially, types of antibiotics used in food animals. Yes, it's almost the same types as in human beings. Worldwide, many substances have been used. Some of which are used in human medicine. Some of these which are not used in human medicine. Overall, the three types of antibiotics use tetracycline, sulfonamides, penicillin, and fluoxetine. For poultry, you have a separate set of antibiotics, basically besopressine, tetracycline, tylosin. These are type of antibiotics. But you should understand is that some of the newer antibiotics like carbapenem used in ICUs are not used in animal food. Constrained in veterinary treatment is that in the veterinary care, usually it's an empirical treatment. So each antibiotic is effective against a bacterial species, but we don't have time to test whether this antibiotic is useful against this organism or not. So we keep on giving empirical treatment. Same is the case with human medicine also. So you go with a cough and the doctor will immediately prescribe azithromycin. Yes, you take this and you'll be okay. So we are not sure whether the bug in question is a bacteria or is a virus. Do we require an antibiotic or not? The same constraint is there in veterinary medicine also. One Health approach, Dr. Jess was speaking, is that we should reduce the transmission of resistant bacteria within and between animal and human population. This is central when we aim to fight AMR. So the reservoirs and transmission of antibacterial resistant bacteria should be investigated within One Health. One Health approach means you involve the human medicine, you involve the animal medicine, you involve environment and the social sciences to come with a holistic approach which people can understand. This is how antibiotic resistance comes in a pictorial way. Drug resistance from farm to hospital. The guy goes, he falls sick from hospital, begin back to other patients. This is an example of livestock associated LAMR, say methicillin resistant staph aureus, how this spreads. Molecular epidemiology and study of resistant genes. You should understand is that there are three key terms in this. Is that AMU stands for antimicrobial usage. AMR stands for antimicrobial resistance, where AMU drives AMR through formation of ARG. ARG stands for antimicrobial resistant genes. So antimicrobial resistant genes can be transferred from one pathogen to another. And that is how the resistant pathogens will keep on surviving, and typically the sensitive pathogens will be lessened now. Finally, about drug residues, I don't know how many of you know what is a drug residue. Drug residue means whenever you use suppose a cow falls sick and you give a drug, say penicillin, to a cow. Actually, then you should not use the milk for 24 to 48 hours, because the remains of penicillin will come back in the milk. So drug residue stands for either a parent compound or a metabolite of that parent compound that is used and that comes back into the food. Causes of residues are misuse of drugs, the withdrawal period not being followed, doses which are higher than used. You have unhygienic practices, so use double the dose in cows, which we saw in the previous cases. Then animal feed is not being tested. The animal feed might contain antibiotics also. The concerns of antibiotic resistance. Some of my doctor friends say that you don't need to eat if you have cold or diarrhea. You don't need to take ciprofloxacin. You can take chicken because they naturally they'll contain a large amount of quantity of ciprofloxacin in it. Two types of antibiotics in veterinary medicine. One is banned and second is approved. Banned means, for example, colistin has been banned for veterinary use. Chloramphenicol nitrofurans are banned for aquaculture use. Approved means those antibiotics which are used approved by an approved veterinary doctor can prescribe these medicines. Both these classes can form residues. Maximum residue level is the maximum concentration which is legally permitted. Withdrawal period means it is the period, the day, how many days we should withhold food from, say, you treat poultry with antibiotics, then you should not use eggs for the coming 2 days, 3 days. That is a withdrawal period, so that the antibiotics will fall below a certain limit. Responsibility of the veterinarian says veterinarians should be responsible and should use antibiotics very sensibly. No extra label should not be used, and we should not be using higher generation antibiotics like cephalosporins and fluoroquinolones, which are critically important. I just told you what are the critically important antibiotics for human use. So what are the solutions? Finally, what are the solutions? The action plan is the cornerstone of the government response against AMR. So Kerala was the first state to come out with an antimicrobial resistance action plan. It is called strategic action plan. We have a global action plan in 2015. We have a national action plan for India in 2017. India has more than 28 states. Health is a state subject. Animal husbandry is a state subject. Each state has its own different systems. 28 states, 28 different systems. So we have come out with the Kerala Antimicrobial Strategic Action Plan 2018. These are the strategic action plan. We need to improve and awareness and understanding. This is one such class where we try to improve the awareness and understanding among the students. We should improve the knowledge and evidence. This is also helps in improving the knowledge and evidence of here in the students and the teachers in this case. Infection prevention controls in hospitals. We need good regulations. We need research and innovations, and we need collaboration. This is the release of the action plan by the Honorable Chief Minister of Kerala to the WHO representative in India is Dr. Henk. Our Honorable Chief Minister Shri Pinarayi Vijayan handing over the state action plan to the WHO representative. These are the activities, with some of the activities which we have been undertaking by the veterinary department. We monitor for antibiotic residues in food. We do some survey of antibacterial resistance, though long way to go. We do some awareness program for farmers and veterinarians. We have some issued some of the guidelines, but still we have a long way to go. We have something called as animal resource management system in place for identification of farms, so that if we have a traceability system in place for the farms, this is how we map. This is our department's disease investigation outbreak. This is a GIS-based disease mapping outbreak system. Why I'm saying is that if you can better control animal disease, less the animal will fall sick, the better, the less antibiotics needs to be used. So finally, the way forward is we should be preserving antimicrobials for future generations, for human beings, but also for animals. Because if you don't have animals, you won't get animal food, which is the best source of protein. Antibiotics important for humans should be used very judiciously in food animals only when necessary. Use of antimicrobials in food animals should require oversight by veterinarian. And finally, to conclude, healthy animals and birds, just like healthy people, they don't need antibiotics. Thank you.
Thank you, Dr. Robin, and also Dr. Jess for those insightful presentations. Now the floor is open for Q&A. If you have any questions to either of the speakers, you can either ask directly or you can put your questions in the chat box. If you wish to address a particular speaker, please mention that in the chat box also. Also, the feedback form for the webinar is put in the chat box also. You can put in your feedback in the form given. While we are waiting for questions, a few announcements. As mentioned earlier, this is the second webinar of the webinar series this year we are doing, and we'll be mostly having the concluding third webinar towards the middle of August, before most probably all the colleges here in the state go for on projects. Will be having the third webinar in relation to community engagement, poverty reduction, and other aspects of AMR. So please take a note of it on your calendars before going for on holidays and such. while we wait for any questions, Dr. Robin, if I could maybe ask a personal doubt as such. You had mentioned about sort of refrains in policies and protocol standards within the country. And for quite some time, I think there have been a lot of these so-called labelings on food products such as antibiotic-free or raised without antibiotics and organic and so on. How far do you think this so-called labeling is effective in curbing the use of antibiotics, or how far do you think that is helping in the case of AMR?
You look at it, the organic movement essentially, it started in Germany. Germany is very much organic. The food system needs to be very well developed for an organic thing to happen. Essentially, in India, our food systems are not so developed to come up with organic food because, first of all, we need to control. How you say that you have organic, say you want to have organic milk. How do you say a milk is organic? Essentially, you need to see that the cow is not being fed by any feed. It needs to be naturally being grazing on something. And the milk should be free from all sorts of harmful things, whatever if it produced. Because we had an experience we tried some fish farming in Kutanad region, organic shrimp farming. The problem is that the environment background contamination is so much that you cannot effectively raise the organic this thing. But still, we could manage some of the areas. There are still virgin areas in India where you can do organic farming. About labeling, essentially, see, unless it is being who is seeing whether these labels are correct or not. In animal husbandry, the organic certification is still much long way to go. But in plant production, we have certain good organic systems in our country. So organic labeling for animal systems, I hardly find. But we have certain chicken coming. They say that it's antibiotic free. They declare on the label. But we need to cross verify whether actually they are antibiotic free or not. But anyway, it's a good initiative that at least somebody is saying that they are antibiotic free. So it's the onus is on us to say that prove that okay, these are not actually antibiotic free. So that is the problem in our country. If we don't have huge labeling regulations in our country, so if you mislabel, you have some few penalties under the Food Safety and Standards Act. But the implementation, I don't find any mislabeling implementation being happening on the ground. So that is the problem essentially. So, it's like a traffic signal. If you have a traffic signal, red light, green light coming on, so people will look at it and then cross. If you have no signal, so we keep on crossing in a junction. So in India, that's a problem. We hardly have regulators looking at anything. So, okay, you say, I will say today this is organic, then it's organic, fine. There's nobody cross verifies that. So we are not so sure whether it's actually organic or not, but let us accept, at least for the time being, that what he says is right.
Thank you. There are any questions, you can either put it in the chat or can ask it there. All right, if there are no further queries, you can also contact the speakers through us if you have any further queries regarding the discussions.
You can share email IDs. Share our email IDs.
Okay, fine. I
get back to us.
Yeah, I will share it.
Essentially, I understand that all the students will be so bugged up with this online thing. So people are so tired of the online stuff that they even hate to ask questions. That happens.
Yeah, hopefully we can, if the COVID situation and if and when the COVID situation betters, we can hopefully have more offline meetings also in the coming future. Yeah.
I'm so tired of this online classes. I can see there's so much online happening in a day. Every day they have to see so many hours, and then another from our side also. So that's a problem. People are so tired about online stuff now. 2 years into pandemic is tough for everyone.
So if there are no further questions, we are coming to the end of today's webinar. I would like to take this opportunity to thank everyone for being with us today, especially the speakers for the day, Dr. Robin and also Dr. Jess Vergis for sharing their knowledge on the topic and also for the insightful presentations. Once again, thank you to both Dr. Robin and also Dr. Jess for being with us here today and further enhancing our knowledge on food systems and AMR. Thank you, Dr. Robin and Dr. Jess. Also, I would like to take the opportunity to thank all the ASPIC student members and faculty advisors from the different colleges for being with us today. Thank you for taking the time to be here. And also I would like to thank all my REACT colleagues who are here, Dr. Philip Matthew, Dr. Jaya from Vido, and all others who are attending today for in supporting this event. Once again, I would like to thank one and all for being here. Have a nice evening. Thank you.